From 2005 to 2011, Golisano Children's Hospital of Southwest Florida's Neonatal Intensive Care Unit, or NICU, has seen an 800% increase in the diagnosis of neonatal abstinence syndrome. 2011 projections show that nearly 15 babies per 1,000 are born with NAS. There is also a proportionate increase in mothers who are being treated with methadone, as well as mothers who are using prescription narcotics such as oxycodone and roxicodone. This can have a negative impact on the baby's developing brain. When born, the infant will exhibit signs and symptoms of drug dependency. NAS can be caused by alcohol, cigarettes, marijuana, and antidepressants. However, opiates and narcotics have the strongest association with drug dependency in a newborn. It is preventable, and education is the key.
NAS stands for Neonatal Abstinence Syndrome. 15 years ago, a NICU nurse would have had a hard time coming up with what those letters stood for. Now it's very common, and any NICU nurse can tell you what NAS stands for because of the kind of epidemic proportions we're seeing in NICUs across the country.
Overall, the incidence of neonatal abstinence syndrome is increasing, but in our area it's increasing, I think, at a more significant level. We believe that our increase in neonatal abstinence syndrome is concurrent with a societal epidemic in usage of prescription drugs. In the state of Florida, we have seen proliferation of businesses prescribing drugs, entities that have been nicknamed pill mills. And this is really a disturbing change of events that is actually occurring nationwide. In
all my years of nursing, it is the single most difficult thing I've ever had to sit back and witness, is to watch really an innocent baby lay there and suffer through their withdrawal, and knowing that despite the fact that we're giving them medication and consoling them and taking care of them, they're still suffering.
Though the numbers are staggering, there is hope through awareness and providing education to women and their physicians about the potential risks. The Neonatal Intensive Care Unit at Golisano Children's Hospital of Southwest Florida has been implementing a consistent approach to the treatment of NAS since 2002, but we want to eliminate the need for this care. There are 3 steps to treatment. First, nurses go through a rigorous educational process where they learn about implementing the Neonatal Abstinence Scoring Tool, also known as the Finnegan Score. This helps us diagnose NAS. Then the tool is implemented during a week-long observation period. If during that time the newborn starts to develop elevated scores that are consistent with NAS, we will implement treatment. The treatment is non-pharmacological, meaning we want to keep the child as soothed as possible. We have put into place a cuddler program. The staff will provide soothing, swaddling, and all the things that a normal baby without NAS would respond positively to.
Unfortunately, all pregnant women are at risk for potential adverse effects on the growing fetus. We see babies born with neonatal abstinence syndrome who may have developed this because the mother was using illicit drugs such as heroin, or using prescription drugs inappropriately or not under the supervision of a physician. We also see moms who legitimately are dealing with the challenges of chronic pain and under the care of a physician have been prescribed a narcotic. At the time of pregnancy, the mother may demonstrate a dependency on that narcotic or really not be in a position to function effectively without this treatment.
Education to me is the single biggest and best tool we have. If we can educate the mom, educate the community, educate the families of those moms, educate the physicians taking care of those moms, from the young family getting ready to start a family to the primary care physician who's considering prescribing OxyContin to his 17-year-old patient for her chronic migraines, or prescribing OxyContin to a 20-year-old who's been in a horrific car accident, and then if those medications are prescribed, following them carefully to assess the potential for addiction.
Treatment provided to babies enables them to be weaned from their dependency to opioids before they are discharged, but there is still a risk for long-term effects. We knew we had a problem and started a task force in our community that includes drug treatment centers, methadone clinics, pain clinics, law enforcement, politicians, physicians, and the health department. We want to replicate this model in other states, but it all starts at home. Spread the word. Educating others about NAS is the first step to eliminating the problem and changing lives in the process.